I think there is huge potential for mental health to find that its time has come. There is a social movement that is gathering momentum to make sure that proper mental health, as well as treatment for poor mental health, is delivered in this country. One example is Thrive London, where the whole of London is joining together to get a social movement to improve the mental health of Londoners, to improve their well-being. It's engaging Londoners in a conversation so that they can begin to talk about it and normalise mental health as a topic we can all share together. There's two key areas the NHS has got to address to really make sure we reach that extra 1 million people on mental health. First thing is we've got to have the people to do it. Now that means that we've got to address the mental health workforce, but we've also got to address a lot of lay people who can get engaged in this in the voluntary sector, and I think one real untapped source is trained peer workers getting engaged in this work. That's the first thing. Second thing, we've got to really tackle the stigma. We have got to normalise conversations about mental health, whether it's at school, whether it's at college, in society, in the workplace, everywhere, so that people are used to beginning to talk about how they feel and where their mental health is. And I came across a wonderful phrase in an article recently where somebody said we need to train people at work, employees, that it's okay not to be okay. Because if they can admit to not being okay, we can intervene early and prevent them being out of the workforce, often for prolonged periods. Lots we can do, but those two things are the key things, I think. Meetings and conferences around mental health are very important because very often people who are working in their little silos can feel quite isolated, and it's really useful to bring people together into a group so they can share, they can network, they can hear things, they can be challenged, they can challenge back, they can be provoked and take things back thinking, I need to do something differently. I think that's hugely beneficial and an essential part of what we all need. What's inspired me about today is the passion of people at this conference about mental health. So when you present something, people are responding, they're coming back to you saying, this is important, what about that, have you thought about this? And there is a real passion to see mental health improved. And I think there is a social movement going on. It's a wave that we need to surf because it won't be there forever, and we need to make use of that wave to make sure that we improve things for the future now. We can't afford to wait.